Well, good morning, everybody, and thank you for joining us here today. I'm delighted to be here to kick off the announcement of the 2012 Surgeon General's report on tobacco use among youth and young adults. And I want to start by acknowledging some of my terrific colleagues, Dr. Regina Benjamin, the Surgeon General, who you'll hear from in a few minutes, Dr. David Satcher, who's with us, a former Surgeon General who has been involved in this effort for a long time. Dr. Howard Koh, my Assistant Secretary for Health, who you'll also hear from. We have key members of the Office of the Assistant Secretary of Health staff, leadership, wonderful team here from CDC, Dr. Perry, who's the author of this report, who comes from Texas to be with us today, and lots of you who have been involved in this effort for a long time. Since the first Surgeon General's report on tobacco was published in 1964, the good news is we've seen the percentage of Americans who smoke steadily decline. In 1965, over 42% of Americans smoked. By 2004, it had fallen to just under 21%, and that's very good news. But for all the progress we've made, tobacco use remains the biggest single threat to Americans' health. It kills an estimated 443,000 Americans every year, 443,000. And every tobacco-related death is replaced by 2 new smokers under the age of 25. Today's report brings more troubling news. It's the first of its kind to explore the causes and consequences of tobacco use among youth and young adults. And it shows us just what we're up against. Today, all over America, there are middle schoolers developing deadly tobacco addictions before they can even drive a car. And the younger a child is when they try cigarettes, the more likely they are to get and stay addicted to nicotine. One child picking up a tobacco product is one too many. But the fact that each and every day across America, more than 3,800 kids under 18 smoke their first cigarette is completely unacceptable. But this report also underscores the importance of the historic efforts the Obama administration has taken to stop youth from using tobacco products and to help adults quit smoking. Since the numbers weren't changing fast enough, we had to change the way we rid our communities of tobacco. So that's exactly what we're doing. We push wide-ranging legislation that, among other things, makes it harder for tobacco companies to market to our children. It also restricts companies from using terms like light or mild on products and in marketing. And it bans certain candy and fruit-flavored cigarettes. All of those were techniques aimed at people often younger than 18. That legislation had been debated for years and years in this country, and we finally got it done. We're also supporting local programs to help people quit smoking and stop people from starting in the first place. As part of last year's health care law, we gave Americans better access to counseling to help them quit smoking before they get sick. Around the country, we have great partners. We've seen states join this fight, with 28 states and Washington, D.C. passing smoke-free laws to improve health. Over the last 3 years, we've also made great strides in our fight against tobacco, and our efforts are paying off. But today's report is an important reminder that we have a lot more work to do to make tobacco death and disease a part of our past and not a part of our future. Again, thank you for being here today for this important announcement, and I'd like to turn this over to our Assistant Secretary for Health, Dr. Howard Koh. Howard.
Thank you so much, Madam Secretary, and thank you so much for being here, everyone. The Secretary has another commitment and has to leave, but we want to, of course, thank her for her tremendous leadership and dedication to eliminating the tobacco epidemic. So I, too, am delighted to see so many wonderful colleagues and friends here. And let me thank Dr. Benjamin, who you'll be hearing from in just a minute. our great colleagues at the Department of Health and Human Services, at FDA, at CDC, at the Office of the Assistant Secretary, and so many others. We want to thank Dr. Cheryl Perry, the Senior Science Editor of this report, and all of our colleagues who helped edit and write this very important product. And most important, we want to thank each and every one of you for being here to support this very, very important effort and this great day. We're here today to bring heightened urgency to the tremendous public health burden that tobacco continues to impose on our youth, a burden that's completely avoidable and completely preventable. Too many of our children are addicted, too many cannot quit, and too many go on to die far too young. In fact, as you heard from our secretary, each day more than 1,200 people die due to smoking, and each death is replaced by at least 2 new smokers under the age of 26. I have personally witnessed this cycle of dependence and despair as a physician who has cared for patients for over 30 years. And I can tell you, it is heartbreaking when our patients tell us that they want to stop smoking, but they haven't yet been able to do so. And it is tragic when our lung cancer patients tell us that they started smoking as kids years ago to be cool and to impress the other kids next door. Today, we understand even more clearly that youth smoking is not an accident. It doesn't just happen. Each year, the tobacco industry spends $10 billion on marketing and promotion of tobacco products. This exceeds $1 million an hour, over $27 million a day in the U.S. alone. The tobacco industry says that their intent is only to promote brand choices among adult smokers. But there is a difference between stated intent and documented impact. Because regardless of intent, the impact of tobacco marketing is to encourage underage youth. And in fact, nearly 90% of smokers start by age 18, and more than 80% of underage smokers choose brands from among the top 3 most heavily advertised. You will hear in this report a major conclusion that advertising and promotional activities by tobacco companies cause the onset and continuation of smoking among adolescents and young adults. Research documents a dose-response relationship. The more young people are exposed to marketing and promotional activities, the more likely they are to smoke. Far too many kids still see smoking images and messages every day that normalize this dependence. For example, in 2010, nearly a third of the top grossing movies produced for children contained images of smoking. Just about half of our states continue to allow smoking in public places. Images and messages normalize tobacco dependence in magazines, on the internet, and at retail stores. In short, kids see smoking in the movies they watch, the video games they play, the websites they visit, and in the communities where they live. From 1997 to 2003, youth smoking fell rapidly. But since that time, the rate of decline has slowed. In fact, there would be 3 million fewer smokers today if we as a society had sustained the success in declines seen between 1997 and 2003. And of great concern, we are also seeing youth consume other tobacco products, including smokeless tobacco, hookah, and small cigars. So in total, we can now document at least 3.6 million youth cigarette smokers, as well as 1.7 million adolescents using non-cigarette products such as smokeless tobacco products and little cigars. Moreover, many young people are concurrently using multiple types of tobacco. In fact, among those who use tobacco, more than half of high school males and nearly a third of high school females use more than one type of tobacco product, whether it be cigarettes, cigars, smokeless tobacco, or some other form. This Surgeon General's report not only provides powerful detail about the factors that lead to youth use, but also identifies proven effective strategies that can advance prevention. We at the Department of Health and Human Services have committed to strengthening and fully implementing these proven effective strategies as part of a comprehensive, coordinated national approach. In November 2010, we were proud to release Ending the Tobacco Epidemic, a tobacco control strategic action plan for the United States from the Department of Health and Human Services. The plan sets forth specific actions where the department can implement progress, build on recent legislative milestones, respond to the changing market for tobacco products, and support robust tobacco control programs throughout the country. We have ample evidence that these comprehensive, multi-component interventions work. Such programs more than pay for themselves in terms of lives saved and dollars saved. The current problem is that we have not yet fully applied the evidence-based tools that would end this epidemic. Between 2005 and 2010, 20 states had declines in smoking prevalence of 20% or more, and that's encouraging, but we need to accelerate these declines in each and every state and sustain them to benefit all of our kids for the future. Until we end the tobacco epidemic, even more young people will become addicted, even more will die, and even more families will be left behind, devastated by the loss of loved ones. So thank you so much for being here today. We must redouble our collective commitment to accelerating comprehensive programs, making cessation services accessible and affordable, creating an environment that denormalizes this dependence, and most of all, give our young people a fighting chance to be healthy and tobacco-free. Thank you very, very much for being here. So I'm very pleased now to introduce our Surgeon General, Dr. Regina Benjamin.
Good morning. It's such a nice turnout. Thank you all for being so interested in such an important public health issue. Thank you, Dr. Coe, for sharing with us the department's and administration's commitment to tobacco control. I'd like to say a very special thank you to our Secretary Sebelius, even though she had to leave, for her strong and unrelenting leadership on this most important public health issue. She has made it a top priority. I'd also like to just recognize my tobacco-free advocates, the young students and group that I've been working with through the years. There's some from North Carolina and Virginia. Why don't you guys stand up? There were some others. And also the others who are watching on the web as we web stream this. You know, the 2012 Surgeon General's report, Preventing Tobacco Use Among Youth and Young Adults, is a result of the contributions of over more than 130 health experts. And so I'd like to recognize the editors who are with us today, Dr. Cheryl Perry, Dr. Melissa Stigler, Dr. Frank Chaplukla, that are here, and they'll be here to help with the question and answers if you get into too detailed things. Also, I think Dr. Woody Kessler is here to represent Dr. C. Everett Koop, and so thank you for being here. But I'd like to recognize and thank my medical school professor and mentor, Dr. David Satcher, the 16th Surgeon General, and all of the former Surgeon Generals for their work on tobacco, nationally and internationally. Every Surgeon General since 1964 has weighed in on the issue of tobacco, and everyone has called for an immediate action to solve this problem. Today's release is the 31st Surgeon General's report on tobacco, preventing tobacco use among youth and young adults. And it reminds us once again that the burden of tobacco puts a heavy burden on society. The report challenges us to end the epidemic of smoking among young people. And the numbers in this report are shocking. You've heard some of them earlier, but they're worth repeating. Every day, 1,200 Americans die from smoking, and each of those people are being replaced by 2 young smokers. Almost 90% of those replacement smokers smoke their first cigarette before they're 18. And despite all the reductions in tobacco use in the past decade, today, more than 600,000 middle school students smoke, and 3 million high school students smoke cigarettes. Also, nearly 1 in 3 young adults between the ages of 18 and 26 smoke. And this is a higher rate than any other age group. So this is a serious public health issue. One of the most serious findings in this report is about nicotine addiction, and the younger they begin smoking, the more likely they are to become addicted. Every year, 1.4 million youth under the age of 18 try their first cigarette, and many of them end up being lifelong smokers. Cigarettes are designed for addiction, and nicotine is a key chemical compound that causes the powerful addicting effects in cigarettes. Added ingredients and design features make them even more attractive and more addictive than ever before. Many ingredients like sugar and moisture enhancers when they're added, they reduce the harshness and they improve the taste and consumer appeal. Chemical ingredients such as ammonia convert nicotine into what we call free nicotine that more quickly crosses the blood-brain barrier. And ventilation holes and filters make smoke easier to inhale deeply into the lungs and also convert the nicotine into free nicotine. All these design features work together to enhance the addictive kick and the pleasure that smokers feel. And adolescents' bodies are more sensitive to nicotine, and adolescents are more easily addicted than adults. This sort of helps explain why 1,000 teenagers become daily smokers, and 3 out of 4 high school students continue to smoke well into adulthood, even if they had attempted to quit in a few years. And there are also other tobacco products that youth find appealing. Some of the cigarette-sized cigars include fruit-flavored and candy-flavored things like strawberry and grape. And some of the latest smokeless tobacco products are spitless, and others dissolve like mints. Part of their appeal is that they can be used at school or at home, in front of mom and dad, even, so they can't be detected, and they may not even know their kids are using them. But understand that these products can also cause nicotine addiction, which can lead to serious disease and even death. This report also highlights some of the health effects. In addition to the increased risk for serious chronic diseases like cancer and heart disease and emphysema, there is a immediate damage to the heart and to the lungs. Studies show that many young smokers have early cardiovascular damage, particularly early atherosclerotic changes in the aorta. That puts them at higher risk for aortic dissection, and they tend to die very young. Smoking during adolescence slows the development of the lung function, and teens who smoke can end up as adults with lungs that never reach their full functioning capacity. Another finding in this report is that marketing and advertising of tobacco products to young people have been very successful. In this report, scientists use epidemiologic studies and evidence to show causality. The more the youth is exposed to marketing and advertisement, the more likely they are to start and maintain smoking. In the United States alone, more than $1 million an hour, over $27 million a day, is spent on targeting messages and images to portray smoking as an acceptable and appealing activity. We know that prevention is the key. 99% of smokers begin smoking before the age of 25. So we want to prevent our next generation from ever starting to smoke. If we can just get them to remain smoke-free till they're 26, then less than 1% of them will ever start. We know what works. We know that when we enact smoke-free policies, we reduce exposure to secondhand smoke, prompt smokers to quit, change social norms, and support healthy decisions. We know that when we increase the price of tobacco, smoking rates decline among youth. We also know that when we educate the public with aggressive media campaigns, we inform them of the risk, encourage tobacco users to quit, and prevent youth from starting to smoke. And science tells us that sustained, multi-component programs prevent young people from starting to use tobacco. We saw this approach in New York City when they cut their youth smoking in half in as little as 6 years. We have implemented these types of comprehensive tobacco programs in the past, and we saw a steady decline in the rate of youth use between 1997 and 2003. Had we maintained that course, we could have prevented 3 million smokers. We need to bring back that level of commitment, bring it back to the programs today. It's time for us to really end the single most preventable cause of death in this nation. And as you can see, we're committed to say we can make our next generation tobacco-free. So I've tried to describe to you some of the many findings in this 2012 Surgeon General's report. The full report is 900-page long, and it's really written for a scientific audience. But it really is important that Americans, and all of Americans, understand that we can end this tobacco epidemic by preventing youth from ever starting to use it. And so we've developed a consumer booklet that you can see that's in your packet. And it's written in plain language and good graphics, and it's entitled The Surgeon General's Report, Preventing Tobacco Use Among Youth and Young Adults. We can make the next generation tobacco-free. And I'd like to say thanks to the Centers for Disease Control and Prevention's Office of Smoking Health, because they've helped us with a new project. So I'd like to formally and officially launch the Surgeon General's Video Challenge. And this is a competition to engage young people in developing original videos that feature one or more of the Surgeon General's report findings. Contestants are encouraged to use this consumer piece that I just showed you as a guide to writing their health messages in their videos. And the contest will have 2 age categories with English and Spanish, age 14 to 18 and age 18 to 24. And you can join as an individual or as groups, as teams, such as schools. And after you submit your video, it'll be screened. And after it's screened, eligible videos will be put up on CDC's YouTube channel for public voting. And then the top 10 of those will be judged by an expert panel. There's also a $5,000 grand prize and several $500 runner-ups. So we're looking forward to having some good videos in this competition. More information can be found at surgeongeneral.gov. So I thought I would now show you my video. That it's also called a PSA, or public service announcement. So.
At 12, I smoked my first cigarette.
At 15, I was addicted.
By 40, I'll have lung disease.
At 50, I'll die of a heart attack.
Cigarette smoke causes immediate damage that leads to health problems, even death. Those who quit or die are being replaced by a new generation of smokers. I'm Dr. Regina Benjamin, United States Surgeon General. Go to cdc.gov, learn how to make our next generation tobacco-free.